Greetings. Let us learn about Hot Snare. This is one of my favorite instruments. And if you look at the impact of Hot Snare among all the endoscopy devices, according to Dr. Michael Sivak, Editor-in-Chief of Gastrointestinal Endoscopy, Chief of Gastroenterology at the Cleveland Clinic initially, followed by chairmanship at the Case Western Reserve University, a mentor and a role model to many GI endoscopists. In his interview to the Video GIE, he mentioned that among all the devices, Snare had made the most impact. It had reduced colorectal cancer and reduced colorectal cancer deaths. By snare polypectomy, you break the cycle of a polyp going to cancer. So let us learn about snares. As you can see, there are two different varieties of snares. One is a cold snare that has no electric outlet and it cuts by just mechanical transection. It is predominantly used for resection of small polyps, size from 3 to 8 millimeters, and it is also used for removing bile duct plastic stents, pancreatic stents, as well as long foreign bodies like ingested pencils in the stomach. Compared to the cold snare, hot snare has an electric connection and it cuts by using heat. It is used for removing pedunculated polyps, sessile polyps, flat polyps, any polyps bigger than 5 millimeters in size. The hot snare, using a special type of current, could be used for ablation of microscopic polyp tissue at the edges of the resection of a flat polyp to prevent recurrence. It is also used for controlling bleeding. So hot snare is useful for resection of polyps, ablation of polyp tissue, and hemostasis. So now let us look at the various types of hot snares depending upon the size and configuration of the loop. These could be round, oval, hexagonal, asymmetrical, and depending upon the diameter of the wire, could be thin or thick. Operation of a snare is similar to operation of any of the other endoscopy devices. You have a thumb ring to put your thumb in and another 2 rings on the slider for your forefinger and middle finger. With a closed grip, the snare is enclosed inside the plastic sheath. If you open the grip, the snare opens. If you close the grip, the snare closes. Open the grip, snare opens. So how do we use a hot snare? In order to use a hot snare, the patient should be connected to the electrosurgical unit using a returning pad that is placed on the back and a connection from the electrosurgical unit to the snare, the electrode. and the circuit is completed by pressing on the foot pedal. I want to make one point. You can see that the electrosurgical unit is right in front of the endoscopist within view. It's important to keep it in front of the endoscopist so that it is within view, not hidden behind the endoscopist. Instead, it should be brought in front so that before the endoscopist uses the current, he could check the parameters so that the right parameters are set, and the endoscopy assistant has the responsibility to share what parameters are set on the machine and say it loudly. So, important to keep it in front of you, not behind. If it is behind, pull it to the front. When you look at the parameters, you can see there is a yellow box on the left, that is for current, and the blue box on the right, that is for coagulation current. Yellow one for cut, blue for coagulation. So let us learn a little more about the electrosurgical unit setup. Just refresh this. So here is the electrosurgical unit. You attach the returning pad to the back of the patient on the loin and hook it up to the neutral electrode there, and then attach an electrode to the monopolar socket and attach it to the snare. So once the snare is inside the patient and around the polyp, and you press on either the yellow or the blue pedal, the circuit is completed and electrosurgery will be performed. So in terms of how do you activate the electrosurgery circuit? Yellow is for cut, blue is for coagulation. If you want to use a cut current, you press on the yellow pedal. On the other hand, if you want to use the coagulation, you press on the blue pedal. So that is something important to keep in mind. I typically use EndoCut Q on an OB machine, effect 3, duration 1, interval 3. If you want to learn a little more about these, you could go to the electrosurgery video and you could learn those details. Once the snare is out, and in this case we injected fluid and lifted the polyp, you place the snare around the polyp, close the snare, and then use the EndoCut Q cutting current, press on the yellow pedal as the snare is tightly squeezed, and it will cut the polyp nicely. And then you complete the cut by repeated application of the snare and completing the resection. Here, before we decided to cut, we lifted the polyp with submucosal injection using indigo carmine solution that is diluted in saline. So the indigo carmine is taken up by the submucosal fibers, and the cut is limited to the submucosa. So you can see the intact fibers, the fibrous tissue of the submucosa. It's important to appreciate that when you use electrosurgery with a snare, the injury, the electrosurgical injury could go deeper and damage the wall of the colon. If the damage goes deeper and deeper and through, it could result in perforation. So, could we identify the depth of injury based on the findings? The answer is yes. So, let us learn about the depth of injury with electrosurgery in patients who have had a polyp that was lifted using a dye to stain the submucosa. So here you could see the intact submucosa, but underneath it you could see the muscle fibers. And if the damage goes deeper, there will be damage to the muscle, as you can see here. And if there is a full thickness resection and perforation with visible peritoneal fat. So one of the complications of electrosurgery using hot snare complication is deep thermal injury and perforation. Sometimes if a vessel is in the way of the hot snare resection, it could lead to bleeding. So the two complications of hot snare resection include perforation and bleeding. They can happen immediately during the procedure or within the next few days as well. So now let us talk about a little more about this polyp resection. And here we are using endocut Q and doing the resection. So as you can see, the resection has been completed with endocut Q using the yellow pedal. And if you want to ablate the edge, you want to change the setting from forced coagulation to soft coagulation. And with soft coagulation setup at effect 4 and 80 watts, it could be anywhere between 50 to 100 watts. Typically, I use 80 watts, and the endoscopist will ask the technician to close the snare and then reopen gently so as to just see the snare tip. And that snare tip could be used with the soft coagulation to ablate the edge of the polyp to destroy any microscopic disease and cut down the recurrence. In order to do soft coagulation, the endoscopist presses on the blue pedal. If there were to be bleeding, the bleeding could also be controlled, and by using a soft coagulation current and pressing on the blue pedal and touching on the vessel could seal that blood vessel. So we have learned about different aspects of the snare, especially the hot snare, and let us review the complications that we have already talked about. Two important complications. One, bleeding, which can happen immediately during the procedure or it could be delayed. Another one is perforation, which could be immediately during the procedure or due to the delayed thermal effects, and it can happen a few days later as well. I hope this is useful. Thank you.